Over the past 50 years, Africa has had more than 30 Ebola outbreaks affecting more than 350,000 people. When the outbreaks end, there are jubilations, fast responders and doctors depart, and ambulances go quiet. But what about the mental health of survivors? Welcome to Talking Science Africa, a show where we bring you scientists and researchers to explain the work they do in a layman language that you understand. Today we are joined by Dr. Rwamahe Rutakumwa, the author of a recent paper published in PLOS Mental Health, which looked at the mental health struggles of the survivors of an Ebola outbreak that happened in Uganda in 2022 in a district called Mubende. Doctor, welcome to the show.
Thank you very much.
Congratulations on that publication. I found it very, very insightful. For me, the first question would be, most of the studies that we see about Ebola look at the virus itself. Why did you and your colleagues decide to focus on the mental health of the survivors?
So, thank you for giving this opportunity to me to share my perspectives, drawing from the research work that we have done, which you have just mentioned. I think it's important really this is a good opportunity for us as academics, as researchers to talk about the work we do, because at the end of the day we really want citizens to hear what we're doing and hopefully to benefit from this, and they need to know. So what caused us be interested in the mental health of these people? Mental health is very, very important, an important consideration. Yet research has, on a number of occasions, actually many times, not paid enough attention to that. And why, in the case of Ebola, mental health is so important is that the nature of the disease itself is not like many other diseases. You know, when you consider from the time someone is suspected of having the disease, the nature of evacuation of these suspected cases, you know, it draws a lot of, it causes a lot of stigma, because, and before we even go very much into that, it needs to be understood that stigma is, why stigma is so important is that in the case of Ebola, it is the fear, it comes from the fear of contagion and the fear of catching the disease, in other words. Because catching Ebola, unlike many other diseases, is a very serious thing, because it is the risks of dying are very high. So the stigma comes in a sense that those who are suspected, even families, are thinking of, you know, they being discriminated against, being blamed, because that's what usually happens when survivors, long after the disease someone has recovered from the disease, they are discriminated against. They still think that they can infect, community members may think that they can still infect others. So it is a very important thing. During evacuation, the stigma comes from the fact that everyone is looking at them, and the community members, I think, are looking at this person as someone not to be associated with. Even during their stay in the isolation center. You know, the isolation center is a place where they hold those suspected cases pending tests. Now, these tests can come out positive or negative. Yeah. So while they are there, the way they are treated is a case of a lady who had a baby, a 3-week-old baby who was taken to the isolation center, and they took the tests, and these tests just returned a positive positivity for the mother and the negative test for the baby, and this baby was carried away and very, very, you know, without consideration to the emotional concerns of the mother and all that. And all these things exact a lot of mental stress, distress actually to the person who is. So during evacuation, during their stay at the isolation center, after they have been, for those who are lucky, when they have the survivors, when they go into the community, they are discriminated against. So the stigma of being of children of those families that have had Ebola being told to go back by the schools to go back because the fear of getting infected, these children infecting others, and part of it is because of not knowing, not having enough information about the disease. So there's a lot of stigma associated with the disease, needless to say, which bears heavily on the mental health of those who have gone through it.
So we know that stigma is there, as you explained, because of the nature of the disease. But you did this study 1 year after the outbreak was over. I think perhaps more than 1 year. What were your findings about this stigma?
So the findings were that, well, I guess I wouldn't talk about stigma at the end. It would be insufficient for me to talk about stigma after those patients have recovered, the survivors. It's important to also touch on when the time during which they were being treated and when they were being evacuated. So you're asking about the kind of what kind of stigma these people were facing?
Yes, yeah.
So I guess what I would do, the kind of stigma these people were facing during evacuation, when like I was saying, when these people were being evacuated and the ambulances were coming and everyone was dressed in personal protective gear, which was supposed to ensure they don't acquire the disease itself, and community members are looking at them, and the effect of this is that when this person recovers and he comes back, these people, having seen the way this person was being evacuated, wouldn't want to associate with them, and so that informs the way they relate with community members when they have been long after they have been cleared and have gone back, reintegrated into the community. We have cases where someone a survivor is walking along the community road, and someone from far there sees them, and they're just taking another path because they don't want to meet with him. Someone goes to the shop to buy something, and the shop attendant says, "No, it's okay, you don't have to pay me," because they don't want to touch the money. They fear that this person. So this stigma, and some of them were so mean. Some community members would see someone who has suffered from Ebola and say, "Hey, Ebola man, how are you doing?" That label, that's the kind of stigma that survivors of Ebola were going through, which stemmed from their entire experiences right up to the time they were discharged and were reintegrating into the community. And of course, I have just slightly mentioned about the schools, how the kids of these families that had Ebola would go to school and they're being asked to go back for fear of them spreading the disease to others. So that kind of stigma has a lot of implications for their mental health, because they feel segregated, they feel they're not human enough, and that's the problem with it. This dehumanizing. It's a dehumanizing experience.
How about years later? What did you find? Did you find that this stigma was still that very strong? Had it reduced? Had anything changed?
Well, with the passage of time, it can be expected that it's not going to be as much as it was when they had just been discharged, but the stigma is still there. There's this bit of it where for example, we know now through research that someone who has suffered from Ebola, a man who has suffered from Ebola, may still have the virus in his sperms for almost up to a year, right? And so that is also causing stigma. We realize that is causing stigma. That community members are looking at this person as someone their wife and other community members are looking at this person who is potentially able to spread the disease. That itself has added to the stigma, because they fear he can, if he engages in sex with a woman, they are likely to cause stigma. So yeah, it is not something that dissipates, or rather disappears immediately after discharge, but it's something that survivors have to contend with for quite a while after being cleared.
The survivors, we are not facing the stigma from just ordinary people in the villages. We are facing survivors from schools and some private health facilities and other institutions where you'd think that these are people who are learned, who should be knowing things, who should be knowing a thing about mental health. Why do you think that was happening, especially in those institutions?
So in those institutions, again, it's a problem of not being very well informed. It was surprising to us as well, because you would think that schools would really be helping put across the message from the Ministry of Health. These schools would be enlightened enough to know that someone who has been cleared of the disease, really, once he has been confirmed to have recovered, is no longer a threat to others. But it was surprising, and we think that it's because there is not enough information. There's still a lot of work to be done in terms of public awareness of the disease and the specific aspects of the disease, for lack of a better way to put it, that individuals really need to know. There's not enough information out there. So it was surprising when it comes to schools. Other than schools, we had health workers who, and I think those are the others you might have alluded to, health workers who could do things a little bit differently, because what they did was, for the case of men who had survived and were known to have families and wives, these health workers would come and engage these without careful regard to the fact that this needed to be done privately. So they would talk about the need to be careful, the need to use condoms and that. So inadvertently, they caused a stigma to those survivors, because what happened was that these survivors were not being discriminated against. They didn't want to be associated. And you know how communities can overstretch the fear to a point where even when you know that this person is a threat, when you imagine that this person is a threat, when you engage with them in sexual activity, even when you might otherwise would be knowing that some community members would still not want to associate with them because of the fact that these people are carrying the disease 6 months, 9 months, 12 months down the road.
That's interesting. You recommended a holistic, person-centered approach to deal with the issue of mental health. How would this approach look like in real practice?
There is this famous Canadian doctor. He's long gone now. He died at the beginning of the 20th century, by the name of William Osler. He said that a good doctor treats the disease, but a great doctor treats the person with that disease. I think holistic, person-centered care is really encapsulated in that statement. That because there is a tendency for biomedical care, the doctors and that, to focus so much on treating the disease without paying due regard to the person who has that disease, because that person has emotions, that person has relations. And I go back to the case of a woman who had a 3-week-old baby who was being grabbed and taken away, and this woman is saying, can you let me at least breastfeed him before he goes? And the doctor is saying, are you stupid? We have just told you you're infected. Do you want to infect this little baby? So you could see a focus on, just an exclusive focus on the part of these health workers on treating the disease, but not the emotional well-being of this person, not the recognition that this person has family and he has relationships, and that what happens with those people, the loved ones, affects their recovery. If your child is a 3-week-old baby, for example, if you think that they are not being taken care of very well, that impacts your mental health. And if your mental health is not good, you're not going to be handling this disease, that deadly disease, in a very, very, very good way, or a very resilient way. So person-centered care, holistic person-centered care, calls for a focus on not just treatment of the disease, but the person. Understand their concerns, understand their emotions. And that then for us means you incorporate mental health in the treatment of this highly fatal disease, which is very, very distressful for those who are suffering from it, but also those who are caring for the sufferers. So that's what person-centered care is.
Right now we are talking about an Ebola outbreak in the Democratic Republic of Congo, which actually has had the highest number of outbreaks in the world. Also where Ebola was discovered in 1976. What lessons can other countries dealing with Ebola outbreaks take from your study, especially on the issue of mental health?
Well, what lessons? I think, plainly speaking, the incorporation of the need to incorporate mental health services in the care for people with Ebola. Up to now, there has not been enough done in the providing mental health care for those who are suffering, those who are actually those who are. There's another study, related study, that we were doing while we were doing this study, from which this publication has come, where we're also looking at the mental health of not just the survivors, but also those who are caring for the survivors. Because these two go through a lot of distress, seeing their loved ones going through what they do. So what we are saying in terms of mental health, really, there's need to seriously consider incorporating mental health in the care of people who are being treated for Ebola, as well as the loved ones. I think mental health care is the incorporation of mental health care is what I can talk about. If you're talking about mental care. If you're I don't know whether you'd like me to talk about some other things, the lessons from this project that we have done. Or probably not.
That's what I was going to ask you. But before that, we have seen, as I said in the past question, have seen many outbreaks across the continent. How does the mental health issue feature in? Does it feature in other outbreaks? What's the difference between what you saw in the case of Uganda in the outbreak of 2022 and perhaps other areas that have had Ebola? Is there any difference in terms of approach to mental health?
In terms of how they have approached mental health? We don't think so, because looking at what the work that has been done during those outbreaks, we really don't think so. I think, especially, I wouldn't confidently talk about what has happened, what happens in other countries, although, of course, I have a fair amount of information based on my literature search. But in Uganda, there is not a lot that has been done in terms of provision of mental health care, regardless of which outbreak. I think this has happened across the board, and that's why our study is highlighting this as one of the key things, the lessons that we need. They need mental health needs to be incorporated into the care of people who have suffered from that disease, but also the health those who are caring for them.
That's very interesting. You talked about the mental health of, we are talking about the mental health of survivors, but you talked about a different study that you were looking at, which actually looked at the mental health of people who are providing care for the Ebola patients and the Ebola survivors. What insights did you get from that study?
So, okay, let me just correct one thing. This study here from which this publication came was also looking at not just the mental health of those who have suffered from the disease, but also those who are caring for them. So we did interviews with not just the survivors, but also those community members and relatives of those who, yeah. And we observed that the same thing, that these people were traumatized, even being not being allowed to get close to their loved ones was such a problem. The fear, you can imagine the fear, you don't know how this loved one is doing. You only get to know occasionally, but you cannot have the chance of constantly observing, and there was a lot of distress on the part of those who were caring. But what I was talking about when I referred to the other study, that study was doing some kind of intervention, providing some mental health support to survivors as well as those who were caring for the survivors and other community members. And so we subjected them to a battery of questions to know their level of distress, and quite a number of them actually. You'll be surprised that many of them, perhaps more than those who had survived, many of the carers had a level of mental illness, distress, and those and related illnesses, and so we subjected them to some intervention. We subjected them to some interventions in the hope that this can eventually help with the recovery from that mental illness. And so we realized that quite a number of them, quite a number of health workers were suffering from that. And so that study was mainly focused on helping them get out of that. And the results we were getting, and we're still doing the analysis, seemed to indicate that these people were doing that, where people had benefited significantly from that intervention.
Perhaps, let's say, 10 years from now, what are your hopes about the subject of Ebola and the mental health? Do you think that mental health is going to be better incorporated in Ebola responses?
That's a good question, because I wish I had a policymaker here, public policymaker here, to provide some assurance. We only hope that with the work such as this one, which were published, and we're engaging, obviously, the policy community, we're engaging the Ministry of Health. And in fact, we are collaborating in this study. When we're doing this study, we're collaborating with the officials from the Ministry of Health. We think that this is going to inform policy, because I can only hope, really, but I don't have the full confidence that these mental health services are going to be incorporated, but I can only hope that eventually these services will be incorporated, because we really don't think that this is all about, we're going to have many episodes of Ebola outbreaks ahead of us, and so the better thing to do is to really prepare and have government put in place some infrastructure and services to address the mental health, as well as other concerns of Ebola survivors and patients as well.
You have talked about that striking case of the lady who the doctors grabbed the child from, because she had Ebola and they were telling her, we don't want you to infect your kid. You talked many other Ebola survivors. What other striking case did you get from the survivors?
So there's quite a number of them actually from the survivors. Some of them shared about the wards, Ebola treatment units being just like should I call it an open concept. The wards were not, they didn't have separate rooms and that. It was a whole dormitory kind of thing, if I may speak in terms of schools. So the problem with that, which was striking indeed, was that Ebola being what it is, and with its high mortality rate, people were dying. People were dying a lot. And it was striking. These people were just having to observe, not just dying a lot, but they would die and the body would be left there. Why? Because of a number of problems. And again, this takes us back to the issue of the ministry needing to really look into developing the needed infrastructure, including equipment. So sometimes the body would be left there. Next is someone who is still struggling, and this person is constantly looking at this and at this person and this dead person, and not only for 1 hour, but several hours. And you can imagine the kind of distress that this person is going through, the one who is dealing with this. Even when they have hopes of recovery, a constant reminder there that someone is dead, that your problem next, was enough to make their mental health situation really, really bad. So it was striking that we had a situation where people were dying, and because Ebola is a high fatality disease, quite a number of people were dying. Like in a single night, about 5, 6, 7 people died, and there were no, the bodies were not being collected as promptly as they should. Partly because there were not enough personal protective equipment. Because these health workers are also human beings, they want to survive. But because they don't, there were not enough personal protective equipment, they couldn't, they just had, I mean, who wants to volunteer death? There were delays because they had to get all these things in place in order to be able to collect the body. So that was striking. And the other thing that was striking was that there's, health workers didn't work constantly around the clock, like 24 hours. No, they would get to a point up to around 10, I think, if I remember well, and they are off. All health workers are off, and so the ward, it doesn't have a single health worker. And so these patients were talking about this situation where the deaths were occurring mostly at night. So you'd have a situation where the patients are there, there's no health worker, no nurse, no whatever, and someone dies, and in the next moment someone is dying. There's a moment when about 5, 6 people died, and people almost, they couldn't handle it, and they were making noise and all that kind of thing. That was another striking thing. So again, that speaks to the need to put better and more infrastructure in place in preparation for future outbreaks, so that we don't have a situation, and of course staff, so that we don't have a situation where these occurrences are coming up again.
Actually, I wrote a newsletter a couple, perhaps 2 months ago, about Ebola and mental health. And for me, what I saw is that perhaps we have had many outbreaks, but there aren't so many studies that looks at the issue of mental health in Ebola outbreaks in Africa. I would ask you, am I right, and why have we had this situation?
The study is not looking at mental health.
Yes,
I think you're right. This is what actually prompted this study here. There's not a lot that has been done in terms of mental health, focusing on those who are the Ebola. And this is striking in a sense that this is a high fatality disease. And therefore, it causes a lot of stress, distress for those, not just patients, but also those who are caring for them, even community members. Because if someone is sick in the community, you think it could be me next time. It doesn't have to be a family member, because you think it could be me next time. So it is striking, but that's the reality. You're right, I think, that there's not a lot of work, and that's what really inspired this study that we did.
And are you hopeful that we are going to get many more studies on this subject in the coming years?
Well, I'm hopeful that more work, more studies will be done to bring this up and to emphasize, to really reinforce the findings that we're getting. But I'm even more hopeful that our findings will inform, really are sufficient to inform the needed interventions, policy changes and provisions, such as ensuring there's enough personal protective equipment, ensuring that the mental health services incorporated into the care of those who are suffering who have suffered from Ebola, as well as those who are caring for those with Ebola. So yeah, for me, my hope is more to do with our study informing policy than to do more studies, although that is still important anyway.
Given that the trauma that people were facing when you did this study, a year after this outbreak in Mubende, we are 2 years down the road, I think more than 2 years. Do you think that those people have fully recovered from this trauma?
No, I don't think so. I hope that they have fully recovered. I think based on what we have observed from our participants, the survivors as well as those who were caring for the survivors, and reflecting on our knowledge of mental health and the character, the nature of mental health, I think it is not implausible, it's not unrealistic to think that someone who has suffered from Ebola today and survived may still have the effects of the mental health effects of that experience many years down the road, like 5, 6, 7, even 10. There is in fact research that is indicating that indeed several years down the road, the mental health effects of the mental health implications of an Ebola, having suffered from Ebola, are still visible several years down the road. So yes, I'd hope that these people are okay, but I think I'm guarded in my optimism that they're okay, because there is a likelihood that some of them are still dealing with those problems, the effects of the mental health effects of that experience of Ebola infection.
Doctor, during that outbreak, we had some health workers denying the existence of Ebola themselves, not just ordinary people who are not educated, but health workers who are professionals. What does this tell us about the risk perceptions and public trust in these public health emergencies whenever there is an outbreak?
Right, yeah, so that was very, very interesting, actually very striking to observe that health workers, these are private health workers. It was very striking to observe that this is, and this is one of our study actually is, and I've tried to do some literature such, and it looks like our study is the one that has brought that finding out, which is that health workers themselves were undermining the effort to fight Ebola. So, and reflecting deeply about it, it spoke volumes about risk perception. There is this theory, availability heuristic. This is a theory on risk perception. Essentially what that is about, availability heuristic is about the cognitive bias, the thinking about that people have regarding certain things based on what they have experienced before. So in other words, someone perceives a certain risk. So what availability heuristic exposes to us is the fact that some people look at risk, perceive risk based on the probability of such events, similar events happening in the past. Their memory of similar events having happened in the past. And what I mean here is that if, for example, Ebola has never been, and this occurred in Mubende and several other districts, the last one of 2022. If, there is this tendency to think that Ebola originates from, Congo, and the people who are likely to have it in Uganda, at least the ones who are likely to experience before any other part of the country are people in Kasese, right?
And the Bondovujo.
And the Bondovujo, yes, correct. So someone will think about what has happened in the past. Have we ever had in their memory trying to recollect? In their has there ever been an Ebola outbreak in Mubende as the epicenter, for example, or these districts that have been affected? If there's none, then they are likely to dismiss the possibility that there's an Ebola outbreak, even when quite surprisingly, even when these people were health workers. They thought that, and I think that is what informed their feeling about whether Ebola, this is real Ebola or not. So we saw that there is this, there's the problem of people thinking, since there has never been an Ebola outbreak starting from Mubende or any other of these districts, then it can't be. Then there was this belief, the popular belief that the government is trying to, steal minerals from the Mubende, for example, and others, and so it can't be it, because that's a government ploy to keep people indoors so that they can exploit their minerals and that kind of thing. And so it was surprising, but that was the reality, that even health workers did not perceive the threat, the reality of an Ebola outbreak the way they should have, and that caused that undermined the effort to fight against Ebola, because these were the ones who were treating, and some of them died actually. These were the ones who were treating these people who eventually infected them and died. So in terms of messaging, and public health messaging and that, there's need to focus on not just ordinary citizens, but some health workers. There's also need to have a very clear and very well thought out communication strategy. And that communication strategy needs really to incorporate community members in the effort to disseminate information about the outbreak, such as opinion leaders and that. Because these opinion leaders would, we think, play a huge role in addressing these suspicions about government trying to grab the minerals, but also in bringing home the message that it doesn't have to have been here before. This is a situation we are facing, and the people are dying. And I think the citizens, ordinary citizens, members of the community, are more likely to relate with the government, the information that is being disseminated by the government, if community members are involved. So I think this for us spoke volumes in terms of the communication strategy. Because it's not only community members, but also even those, surprisingly, who were supposed to have a hand of the risks of catching Ebola. Even those ones are vulnerable.
Thank you, Doctor. Thank you for sharing these insights from this study. We hope that they are going to inform policy and we are going to get better responses in terms of mental health issues when we have future Ebola outbreaks in Uganda.